From Dr. Tucker's Vision Center, I am so happy to welcome back to the show once again the doctor himself, Dr. Tucker. Good morning.
Good morning. Good to be here.
Don't you look handsome in pink today? I love it.
Thank you. It's not green though. But
I know,
pink.
right? All right. So March is Save Your Vision Month, which I think is so interesting because I think a lot of us take our vision, I think, for granted. Do you see that a lot?
I see that a lot. They take it for granted, and they don't realize they have a vision problem because they never go in and get an eye exam, and then finally, by the time they realize they have a vision problem, we may have some real problems there. You know, it's kind of like the person has high blood pressure, never goes and gets a physical and everything, and all of a sudden they have a stroke. Well, it's a little too late then.
Yeah.
You know?
Well, and I think going back to those physicals, the traditional eye exam and what we're going to talk about this morning is such an important part of kind of how your body is functioning and making sure everything is in check.
That's correct.
Let's talk about eye exams, and let's first start with the basics and who should be getting eye exams and when do you start with them?
Everybody should get eye exams. Everybody. And I started doing at 6 months of age. The National Eye Institute recommends 6 months of age babies. And babies are pretty easy to check. You can actually tell what a baby sees at 6 months of age.
Okay.
Okay. And then we know once you hit 40, the disease process increases exponentially every decade after that.
Oh, wow, okay.
And we do know children, just because children have 20/20 vision, considered normal vision, doesn't mean that their vision is okay. There are many other things related to children in developmental vision that they need to be checked on a regular basis.
How many people really just do have 20/20 vision? I feel like everybody kind of has some...
Probably, statistically wise, about 35% to 40% have 20/20 vision without any correction whatsoever, okay? But like I say, 20/20 vision doesn't mean your vision is okay.
Right. Well, and we talk about kids and how important that is. I mean, it can, if they have any kind of vision issue, that can really have a drastic effect on how they learn in school, and I mean, it can really have a ripple effect, too.
Studies show 80% of what you learn in school is through your eyes, so if you really have a vision problem, you're going to have some tough times. And school screenings are good, but they still miss about 30% of children with vision problems.
So it's really important to go see an actual eye doctor. And what are you looking for?
When you're looking in the eye, you're actually looking, obviously, what the visual acuity is, whether the pressure in the eye is fine, no glaucoma issues, no diabetic problems, no hypertensive problems. Those are very critical things, and most of those, they usually have no visual sensations, no pain sensations, till by the time you have a problem. We have some issues with this, and much harder to take care of.
Hereditary, is that, I mean, if your parents have a lot of eye issues and they wear glasses?
If your parents have it, you need to watch that much closer, but particularly if your siblings have it, then there's a bigger possibility that you may have vision problems too. But just because your parents have it doesn't mean you have it. But you have your parents and then siblings have it, then you probably have a very genetic possibility of genetic problems.
Now, when somebody goes in for an eye exam, what should you expect your eye doctor to be doing to make sure you are getting the most
They certainly should be looking at, obviously, what the clarity of vision is. They need to check the pressure in the eye to make sure that the pressure is good.
Is that where what's the little poof machine?
The poof machine is a pressure test. I don't use that. I don't think it's quite as accurate as what I use. I use what we call a Goldman, which is kind of the gold standard of checking pressure in the eye, because I do a lot of glaucoma patients, and you must be using that if you're doing that type of thing. But you're looking for the pressure in the eye. You certainly want a dilated eye exam. In other words,
you do want a dilated eye exam.
Absolutely. And vision is you're looking in a closet. If you just cut a hole in a closet and look in, or you open up the closet door, wow, what a difference of what you see.
Really?
So you need a dilated eye exam to look and see, make sure that overall retina is good. And there are some times that you'll see some systemic issues that the patient wasn't aware of. It could be hypertension, it could be a diabetic condition, could be several other things.
So there's a lot of things. There's a lot of different reasons why that eye exam is so important.
Is so critical.
And then before we close, how often should we be getting them? Once a year? Once?
I certainly would say once you hit 40, once a year, for sure. If you already wear glasses, I think once a year is an appropriate thing to do. I'm a firm believer. There are many different studies that say, well, children every 2 years, every 3 years, every 1 year. But I'm a firm believer that children it's so easy to get an eye exam. Check them once a year to make sure there's any problems.
Well, and I love that you make this, that you try to make it affordable for people who don't even have eye insurance. You're going to have this great offer this morning that you will extend to our Morning Blend viewers.
It will be $99 eye exam, and they will get 20% off any pair of glasses they get, and 30% off a second pair if they get a second pair, providing they have no other insurance. And they mention
the Morning Blend. Again, there is the number to call, but very easy to schedule an eye exam and make sure that nothing is going on, because a lot of times people wait till it's too late.
Wait till it's too late.
This is the great month to do it. So National Vision Month. So thank you so much, Dr. Tucker. We love having you here.
I love
Certainly
being
for
here.
more on information on Dr. Tucker's office or his offer, just head to our website, fox4morningblend.com.
All right, country fans, he's been on the road with Eric Church, Dierks Bentley. Now the singer-songwriter is in the Morning Blend studio to tell you about his new album. Meet Rick Monroe and find out where he will be playing here in Southwest Florida coming up after the break.